If you broke your arm in Canada right now, you'd pay $0. In Germany, 0. Japan, 0. But in America, the average bill for a broken arm is $2,500, sometimes $7,000. And that's if you have insurance. So what is going on? Why does America, the richest country on earth, charge its own people more for healthcare than anywhere else in the world? The answer isn't simple, but once you understand it, you'll never look at a hospital bill the same way again. First, let's talk about what America actually spends. The U.S. spends over $4 trillion a year on healthcare. That's more than the entire GDP of Germany. Per person, Americans spend about $12,000 a year on healthcare. The average for other wealthy countries? Around $6,000. And here's what makes this wild. Americans aren't even healthier for it. Life expectancy in the US is actually lower than in most of those countries spending half as much. So where is all that money going? Reason 1. America has no price control. In most countries, the government negotiates drug prices directly with pharmaceutical companies. They say, this drug costs this much. Take it or leave it. In America, there's no ceiling. Hospitals, drug companies, and insurance providers can charge almost whatever they want. That's why the same insulin that costs $30 in Canada costs $300 in America. Same drug, same factory, 10 times the price. Reason 2. The middlemen. Between you and your doctor, there are layers of companies taking a cut. Insurance companies, pharmacy benefit managers, hospital billing departments. Each one adds cost. None of them actually treat you. Administrative costs alone make up about 35% of all U.S. healthcare spending. In Canada, it's under 12%. You're essentially paying 3 people to hand you a single piece of paper. Reason 3. Profit motive. In America, healthcare is a business. Hospitals are often publicly traded companies. They answer to shareholders, not patients. That means when you walk into an ER, somewhere in a boardroom, someone is thinking about the bottom line. And it's not just hospitals. Drug companies spend more on marketing and lobbying than they do on research. That cost gets passed to you. Now, here's the part that surprises most people. America actually does have a form of government healthcare. It's called Medicare and Medicaid, and it covers over 140 million Americans. But even that system has gaps, and millions of Americans fall right into those gaps. Too poor to afford insurance, but not poor enough to qualify for government coverage. Medical bills are the #1 cause of bankruptcy in the United States. In no other wealthy country does that sentence even make sense. So why is American healthcare so expensive? No price controls, too many middlemen, and a system built to make money, not to make you healthy. Could it change? Maybe. But right now, the people who benefit most from the current system have billions of dollars to make sure it stays exactly as it is. And that's how America works. Next week, we're breaking down why college in America costs so much and who actually profits from your student loans. Subscribe so you don't miss it.